Now for our anti-inflammatory agents, our SLAM team, we have S for steroids, which decreases the swelling, ending in zone like beclomethasone. Now the key points to know for the exam are the 4 S's of steroids. The first S is for swelling and inflammation. Cortico inhalers reduce the swelling directly in the respiratory system. So beclomethasone, fluticasone, and methylprednisolone. Guys, Selimedrol is the brand name. Now, by comparison, glucocorticosteroids are for total body swelling, so like prednisone, dexamethasone, and even hydrocortisone. So we say B for beclomethasone decreases the B bronchi, or basically the lungs. And P for prednisone decreases swelling in the P for person. Now for patient education, we use S for slow onset. Guys, this is not a rescue drug, so do not use zones for the first sign of acute asthma attack. They're used third in line. Now that's a common test question and it's commonly gotten wrong. So NCLEX keyword here, do not use fluticasone or Selimedrol for the first sign of acute asthma attack. And guys, Selimedrol, yes, it's a beta-2 agonist, but this is just here to remind you not to use those. So we use AIM for acute attack. A for albuterol, that's the first drug we use, first in line for brutal asthma attacks. I for ipratropium, always use second. And M for methylprednisolone, brand name Selimedrol. Our steroids always last since steroids act slow. And guys, a big test tip here, do not omit steroids even if albuterol works. We always use these 3 in a sequence. Now for the top 2 side effects, S for sugar increased. So think steroids naturally increase the sugar. Or just think glucocorticoids naturally increase the glucose. Guys, this is completely normal, so there's no need to report to the doctor or HCP. This is an expected finding. Now S for sores in the mouth, basically infection. So just think steroids suppress the immune system, leading to slow wound healing and sores in the mouth. Always a common exam question is who's most at risk for infection? And guys, it's usually a patient on zone steroids. Now the big key points to write down. Use spacers to prevent oral thrush, or basically candida, the oral infection in the mouth. So we teach patients to rinse the mouth after each use. And big one here, do not swallow the water. Always wash mouthpieces out with warm water. And guys, daily for steroids, not weekly. Weekly is for albuterol. So just think steroid inhalers go right in the sink after use. Now the next drug is L for leukotriene inhibitors, ending in Lucas like Montelukast. So the brand name is Singulair, or Zephyr-Lucast. So the memory trick is 3 L's. L for Luke likes to sing, since it opens the airway. L for long-term management of inflammation, commonly given in combo with albuterol and steroids. And the last L for long onset. We have to teach the patients that it lasts 1 to 2 weeks to reach therapeutic range. Now, NCLEX key points here, given for prevention of asthma attacks. Guys, not during acute asthma. This is not a rescue drug. Only buterols like albuterol are rescue inhalers. So the key patient teaching here is this med will prevent inflammation that causes asthma attacks. Now, it does this by reducing the inflammation response of leukotrienes. Basically, it just stops the inflammation response to the irritants. So a common test question, a patient has been on Montelukast for 5 days and states the medication is not working. What's the best response by the nurse? Well guys, the answer is always to advise the patient. It takes about 1 to 2 weeks for the drug to reach that therapeutic effect. Now the last drug class is M for mast cell stabilizers. Drug name is cromolyn. So think it blocks massive swelling by blocking the histamine response, which inflames the body. The key point here is that it prevents activity-induced asthma, like before sports or exercise. Now, the HESI stressed clients to take 15 minutes before exertion for maximum effects. And the ATI was similar, teaching patients to use 10 to 15 minutes before physical activity. Now, some common questions from this section. A client is receiving discharge instructions for inhaled glucosteroid meter dose inhaler. Which teaching should the nurse include? So option number 1, discard the use of fluticasone if albuterol provides relief. Guys, no, we do not omit steroids, even if albuterol provides relief. Guys, steroid acts to soothe, and they act more slow, so we always take it. Option number 2, do not swallow the water as you wash your mouth after each use. Guys, yes, option number 2, we always rinse and spit out the water. Never swallow steroid water. This is going to lead to more sores. Option number 3, if taking albuterol, be sure to use after the steroid. No, guys, we always use albuterol first to open the lungs and then steroids after to get that powder deep inside the lungs. Now, option number 4, steroid inhalers should be used before beta-2 agonists. Again, guys, no, albuterol should always be used before steroids. Now, question number 2, which statement by the patient requires further teaching? So option 1, I will use cromolyn to prevent activity-induced asthma. Yes. I will use montelukast to prevent asthma attacks. Yeah, guys, it prevents the long-term asthma. Number 3, I will use spacers to prevent oral thrush while using beclomethasone. Yes, perfect. How about option number 4, I will take cromolyn 45 minutes before physical activity. No, guys, option number 4 is wrong. Take 10 to 15 minutes before that physical activity. So this would require further teaching.